Hello, and welcome to the Prepping Report. In this edition of the Prepping Report, we are going to do a book review of the Doom and Bloom Survival Medicine Guide. It is published by Dr. Bones and Nurse Amy. You can find it on Amazon.com. I believe they also sell it on their website. I believe it is www.doomandbloom.net. Now, this book is a must-have for any prepper. There's three reasons behind that. Number one is most medical books that you read when you look at a condition, whether it be a illness or whether somebody broke a leg, at the end of it, it says go seek advanced medical help. Well, this book does not do that. This book gives you everything that you need that a person can possibly do to treat wounds. It's under the understanding that there is no advanced medical care available to go to. Secondly, this book is also very realistic. Dr. Bones and Nurse Amy and various conditions that you read in this book state that some people will die. And I mean, that's going to be very true in any type of collapse setting. And I know we don't want to talk about it, but none of us are superhuman. Even with the doctor around, there's still going to be some people that are going to die, whether it be from some type of illness, whether they have diabetes and they run out of insulin, or their appendix ruptures. I mean, that's one of the things they talk about in this book is, you know, if you got an appendicitis, here's something that you can do to help relieve it, but if it still gets worse, you know, the appendix ruptures, you know, there's a possibility, a good possibility that that patient will die. Finally, Dr. Bones gives all kinds of treatment options, from just practical everyday treatment to minor cuts and bruises, to the major things, the use of antibiotics. Also, he realizes that antibiotics will run out at some time. No matter how much you stock, eventually at some point in your preparedness, you're going to run out. Depends on how many people that you have in your survival group and how often you dose your antibiotics out. So he also goes into herbal remedies, which can help you, which will help cure each of these things just as the use of antibiotics will. There's many different topics included in this book. No way I can cover them all in a YouTube video. The first topic that they go into, though, is principles of medical preparedness, because there is a distinct difference between wilderness medicine and collapse medicine. There may be some stuff that overlap, but in a wilderness setting, the go seek advanced medical care will come into play, whereas in a collapse setting it will not. The second main part of the book is becoming a medical resource. He has various chapters in this section, from skills that you need to learn and master, supplies to get in stock, and just basic knowledge that everybody needs to know, like how to conduct a medical exam. He also goes into a lot of other things, personal hygiene and sanitation. That's going to be a must-have for everybody in your survival group. Hygiene will prevent a lot of common ailments that will come about if you don't have good hygiene. He also goes into infections, environmental concerns, different injuries from snake bites to broken limbs to cuts. Another big chapter in there is whether to sew or stitch or to leave an open wound. He also covers chronic medical conditions such as diabetes, high blood pressure, and various other things. Now, it's important to remember that buying this book, reading this book, and even understanding this book does not make you a doctor. You need to get hands-on medical training. If you don't know anything about medicine, start off with the basics. Get CPR certified. You can talk to your local fire departments, especially if you live in a rural community. They offer the first responders course, which is very good. A lot of tactical training companies offer emergency medicine 2-day courses, treating of gunshot wounds. You can also maybe talk, if you know anybody that's a nurse, or maybe if you know somebody that's a doctor that you're good friends with, get in there and talk with them. Try to get some hands-on experience in anything that you can dealing with the medical field. In a collapse situation is not the time to learn medicine and not the time to learn about the human body. We'll do videos in the future, hopefully on medical reference books, to get your knowledge up. Like I said, knowledge is very, very important, but it does not take the place of practical first-hand experience in performing some of these duties that you're going to have to as a medic, or even as a father or mother during a collapse situation. Thank you.